Good morning. Let's talk about Prom. Now, what is this Prom? It is a premature rupture of membrane. Before I tell you the definition of Prom, look at this picture. Here you can see a fetus. This is the amniotic membrane, the placenta, and the amniotic fluid. When do we say the woman has completed her gestational period? Or that even if she delivers, the baby is going to be fine. That is when she completes 37 weeks of pregnancy. Now the definition of Prom. It is a spontaneous rupture of this amniotic membrane after 28 weeks of pregnancy but before the onset of labor. Let me say it again. What is Prom? It is a spontaneous rupture of the amniotic membrane after 28 weeks of pregnancy but before the onset of labor. So what happens once this membrane breaks? The fluid comes out. Now this Prom is of two types, term Prom and preterm Prom. As the name suggests, if this situation occurs before 37 weeks of pregnancy, that is if the membrane ruptures before 37 weeks, then it is called as preterm Prom. If this occurs after 37 weeks of pregnancy, then it is called as term Prom. In majority of the cases, once this amniotic membrane breaks and the fluid comes out, in 24 hours the labor starts and the baby is delivered. But in case, even after 24 hours, if the labor does not start after Prom, it is called as prolonged rupture of membrane. Alright, Prom is seen in about 10% of pregnancies. Now what is a symptom? The pregnant lady comes to you and tells that there is watery discharge coming out of her vagina, either in the form of gush of fluid or slow leak. Now when you come across such a situation, you must have in mind two differential diagnoses. Either this gush of fluid or the vaginal secretion she is complaining of could be urine, because during the later phases of pregnancy what happens is that there is incontinence of urine. Second differential diagnosis is a condition called as hydroria gravidarum. Again here there is excessive water discharge from the vagina because of excessive decidual glandular secretion. Moving on to the causes of Prom. In majority of the cases, usually the cause is unknown, but we have few causes in hand like multiple pregnancies, cervical incompetence, polyhydramnios. Now what is this polyhydramnios? Where the amniotic fluid is in large quantity. That's about 2000 ml of amniotic fluid. Or there is increased, the other reason could be that there is increased friability of the amniotic membrane. All these can cause spontaneous rupture of the amniotic membrane. Moving on with the investigations, a speculum examination will tell you if the fluid is amniotic fluid or urine. You can take a smear of the sample and see it under the microscope. In case of amniotic fluid, you can see a characteristic fern-like pattern. Also, you can collect the fluid from the posterior fornix of the vagina and check its pH. If it's amniotic fluid, the pH that you will get is about 7 to 7.5. The other investigation is that we can stain the fluid with 0.1% Nile blue sulfate, and if you see an orange-blue discoloration, it means what you have collected is amniotic fluid. Now why do you see this orange-blue discoloration? It's because the amniotic fluid has got cells, the fat cells, from the sebaceous glands of the fetus. Other common investigations can also be done like CBC, CRP, urine routine or urine culture, and non-stress test. Now let's talk about the complications of Prom. So the complications include chorioamnionitis, fetal infection, cord prolapse, NEC. What is NEC? Necrotizing enterocolitis, RDS, respiratory distress syndrome in the neonate, chance of cerebral palsy is high, and so on. Moving on to the treatment. Once a patient arrives in such a condition, you check the maternal pulse, fetal heart rate, temperature, and admit the patient. All these measures should be checked every 4th hour. In case of term Prom, that is, if she has crossed 37 weeks of pregnancy, you admit her and observe her for the next 24 hours. Usually what happens in term Prom is that after 24 hours, the woman goes into labor and delivers the baby. And if this does not happen, you can induce her with oxytocin, or if there is an obstetric indication, go for a C-section. So this is the treatment in brief for term Prom. In case of preterm Prom, if the lady is less than 34 weeks, you need to take an extra care. Why? Because there is chance of fetal distress syndrome in the preterm neonate. So in such a case, when she is less than 34 weeks of gestation, you admit her and start her on corticosteroids. Corticosteroids, what is the action? Why do we give it? It's not for the mother, it's for the preterm neonate, for the baby's lung to mature, else the baby can go for pulmonary hypoplasia or respiratory distress syndrome. Along with this, bed rest is required, and a broad spectrum antibiotic can also be started, like IV ampicillin, amoxicillin, erythromycin. That's all in brief about Prom. Thank you.